Hello and welcome to this video tutorial of Plate 107, Head and Neck. So we are now going to transition into the anatomy of the blood vessels. So we've talked pretty extensively of the heart. We've talked about how the heart works. We've talked about the chambers of the heart. We've talked about veins and arteries. We've talked about some of the vessels around the heart. So now we're ready to venture out into some of the smaller roads, so to speak, out into the rural areas. If the circulatory system is the road system, then we kind of think of the heart as being maybe Columbus, those major blood vessels as being the major highways around Columbus, like 670 and 270 and 670 and things like that, if you're familiar with Columbus. Now we're going to get out to the roads where Danville may be located 514 and 62 and US 36 and things like that. So the head and the neck are probably the most challenging, possibly. But as every year I look at it, I think it kind of makes more and more sense. And I think I can do a pretty nice job of explaining to you how it kind of pieces together. So I would encourage you to have your books open to 107. If you're able to print these two slides, that's great. Not necessary, but it may be helpful for reference as well. So I'm going to actually start this first slide will just be about, well, I shouldn't say just about, but mostly about what gets up here to our head. We'll do the neck, which is kind of this left region, in the next slide. All right, so let's start where the heart would be. So the heart would actually be down below my computer here, so down yonder, so way down, not way down there, but down here would be my heart. I know you can't see that anymore. Now, this is a blood vessel that you are familiar with, this aqua-colored. This is the brachiocephalic. So the brachiocephalic, you have seen that. So brachio means arm, cephala means head. So this blood vessel is going to feed the head and the arm. So this blood vessel coming up this direction, so this blood vessel, that's kind of not a very good color, red. And then this blood vessel branching off is going to feed the arm. So here's going to be the head, here's going to be the arm. So those two blood vessels, and so the way I've kind of done this is an outline. So the brachiocephalic breaks off into this blood vessel, the common carotid, which you've actually seen as well. We might have called it it might have been called the common internal or the common, but we've got the common carotid, and this is where you feel your pulse. So when you feel your pulse, this is what you're feeling. So if you kind of put your head underneath, your hand on your neck here, you're probably feeling your pulse about right here. And then what we have here is the subclavian. So I'm going to leave the subclavian for the next, how it branches off into these little blood vessels for the next slide. I'm just going to focus on this common carotid. So you can see how the outline form works. Now the common carotid breaks off into two different blood vessels. So it branches right here. So some of the blood goes here and some of the blood goes up into this purple one. So you got the green and the purple. Now this green one is referred to as the external carotid. It's external because this is going to feed the outside of your skull. This is going to feed your scalp, and in all honesty, this is probably a little smaller, maybe, but they're showing it breaking up pretty equally here. So that external carotid and the internal carotid. Now, let me talk a little bit about that internal carotid, the internal carotid. So the internal carotid, if we actually look at its purple one, if we follow it up, it becomes dotted. Now, what that dotted means is that it's entered into the skull. And when it goes into the skull, so it remains this purple, so it remains the internal carotid all the way up here. So internal carotid, but then it does branch off right here and becomes another letter. I don't remember the letters very well. I think this might be letter N maybe, yeah. So when it branches off here, it becomes the ophthalmic. Now you should remember ophthalmic, ophthal, like an ophthalmologist studies the eyes, and if you look, it's going to the eyeball. So you can it helps kind of do this. So we've got this one down, we got this one down. We're trying to keep track over here of in our head. Now let's talk about that external carotid. So that external carotid, in fact, I probably misspoke. It does branch off lots and lots, so it's likely a little larger. So let's talk about things as they branch off, and that's kind of how I try to do the order here. So the first branching we have is this red one right here, and this is actually going down here, this organ right here, the outline of this organ right here. This is your thyroid gland. Your thyroid gland is kind of your lower neck, above your manubrium. So the manubrium would be down here. So this first blood vessel we have is called the superior thyroid. I'm going to check things off as I talk about them over here to make sure that I do get everything. Make more sense to me. So the superior thyroid, well, if there's a superior, there's probably an inferior, and I would guess you could almost figure out where that might be, but we'll get back to that in just a moment. So superior thyroid, the next branch, and so some blood will go through here, and then some blood will continue on. This blood right here, this is the lingual. The lingual means language, so it's feeding the tongue. So it does actually make sense how they name some of these things. Next is the facial. So if the blood continues on up, then it may exit this aqua-colored. And this aqua-colored one seems kind of weird because it looks like it's going through the teeth and upwards. But you have to remember this is actually going through the cheek. And so this would travel through the cheek onward up to the nose and kind of be feeding some of those muscles that are like remember the muscle that was long here, the nasi aleci, the levator labii superioris nasi, this muscle right here that helps you flare your nostrils. It would be feeding all these, and it is feeding a lot of these muscles of the face, or the ones that are external. All right, so we got facial there. Next, maxillary. So we follow this thing on up. Okay, so we've got this thing breaking off right here. Okay, the maxillary. Going to make sure I'm making reference here. So maxillary is your letter T, which is this little blue thing. Now, notice how it's dotted. That means we're inside the skull. So the maxillary is going to break up into 3 different blood vessels. We've got a blood vessel here. So I'm going to kind of put a circle around that. We're going to have this region right here, and then we're going to have this region right here. So you can see those 3 different colors. So maxillary. Now the first one that branches off right here is actually called the middle meningeal. Middle meningeal. If you've heard of a disease called meningitis, that's a disorder where you have extra fluid and an infection inside your spinal fluid. That's called the meninges. The brain meninges are kind of covering of the brain. We also then have these 2 alveolars. Now the alveolars kind of rhymes with molar, and these are your molar teeth. So I think of the alveolars as feeding the teeth, and there could be some truth to that. So up here we've got this little one. I've got it done in kind of a purple. That's the superior alveolar, and then down below the inferior alveolar. So superior alveolar up here, inferior alveolar down there. So we can check those 2 things off. All right, we're almost there. Now we're going to continue up. So if we remember, we're on our our external carotid. Some of it went down to the thyroid, some of it went to the tongue, some of it went to your face, and all these muscles up here. Thence, if the blood continued on, it might have gone through this transverse the maxillary. Some of it went down to the inferior alveolar, superior alveolar, the ophthalmic up here. But we skipped over 3 blood vessels that actually stay on the outside. So this first one we come to, if we follow this gray one out, we know this region as the occipital. So we just call it the occipital artery. Okay, if we follow up a little more, this red one coming off, this is like the ear area. So we call it the, oops, I kind of skipped over one here. So the posterior auricular. That was the ear. If we continue on up, we get this blue one. This is the temporal region. So we've got the frontal branch of the temporal, the parietal branch of the temporal, but it's called the superficial temporal. We will not be learning about an internal temporal. So probably likely if you label that as temporal, I'm not going to get all bent out of shape or anything like that. All right, we've got 1 to go. We got this blood vessel right here that kind of snakes off of that, and I probably should have actually done a little indentation off of posterior auricular. Let me do that just to be official here. So coming off of that posterior auricular, we actually have this what's called transverse facial, and it makes sense. Transverse If a transversal actually is like kind of a right angle. And so it's a right angle, comes off at a right angle to the, if you notice, it's kind of going right out the zygomatic process, And you might be able to get a pulse there, but it's pretty small. You might not be able to either. All right, so there's the head. So I might encourage you to go through and you'll get this. It's just a matter of practicing, and I'm trusting everybody to work legitimately on these as we work through the anatomy of these plates. So let me actually clear things off here. So if you need to go back through and watch that, please do. But I'm going to continue on now to the neck, which many people get pretty scared by the neck because it looks pretty crazy down here. And I'll be honest, it is, but I'll help you make some sense of it. All right, so we actually don't have as many. That's a good thing, I guess. But I've zoomed in a little bit on the neck, and so we're not going to worry about this. So we have we had the brachiocephalic going into that common carotid, breaking off into the internal, external. We had all those things. So we're just going to focus on these blood vessels that we have down here coming off of that subclavian. So the subclavian is going to go under your clavicle. If you actually notice, here's the clavicle bone. It kind of got cut off here. So I'll kind of continue the clavicle bone. It probably kind of continues kind of like that. And if you look at this blood vessel passes under on its way to your arm. So that's why we call it the subclavian. The subclavian branches off 3 places here. And so we've got branch, 4 times. 1, 2, 3, and then this little one running right here. About threw me off. So that's why I have 1, 2, 3, 4 big circles here. So the first one is this little or smaller one's littler. This smaller one called the internal thoracic. It's going to go inside your rib cage and be kind of doing some of the upper chest. So the internal thoracic, it's this little pink guy right here. Then we have 3 more major vessels that kind of go superiorly to do kind of the upper neck areas. So this first one, this pink one that I have here, it's called the vertebral. And if you notice, it's actually going through some of those vertebral foramen that we actually have, what are called the transverse process, feeds the neck area there. So vertebral. And all these outside of the skull. Then we have these 2 other things that are called trunks. Now they're called trunks because they're very short and they're going to branch off, much like the trunk of a tree. So the first trunk that we come to is called the Thyroid Cervical. Thyro, because one of these blood vessels is going over that thyroid. That's that inferior thyroid that I made mention that we would get to. So we have the superior thyroid. Here's the inferior thyroid. So I got that one down, so inferior thyroid. Next, transverse cervical. So the transverse cervical, and I'm going to kind of go in order that we have here. The transverse cervical is this purple one, and transverse kind of goes sideways. And I'll be honest, this one and this one, I still sometimes get a little bit mixed up. So here we have transverse cervical. And there's where that cervical comes from. There's a thyroid comes from. Now, the last one coming off here is actually headed down to your scapula, so it's going to head down. The scapula is going to be back behind your rib cage, so we call that the Supra Scapular. Remember the Supra Scapular? I think we had supraspinatus muscles, and some of those muscles that are on the scapula. And we have to remember that many of these blood vessels are feeding those muscles. We have to feed our muscles for them to be able to do their work. So suprascapular. So I'll review those again. So we have the inferior thyroid, then we had the transverse cervical, then we had the suprascapular. Almost there. So we've got this one more trunk. This trunk is called the costocervical. Now, cervical, again, because it's neck. And if you forget like what order things go in, just remember the cervical comes secondly in both places. Costo, if you remember cost was one of our prefixes and suffixes. Anybody remember what that meant? Cost, and has nothing to do with like money, but it actually meant ribs. Cost was ribs. The green one going up here has nothing to do with ribs. This is the costo, or the cervical part. It's called the deepest cervical. So if you remember, these are your cervical vertebrae. So we call this deepest cervical, the deep cervical, feeding, remember those spinous processes and all those muscles. Again, all those muscles that are going to be along here, whether it's the trapezius muscles that are up here. We had lots of different muscles, the spleniuses and all those muscles that we had up along here. And then finally, coming off right here, this tiny, the smallest one here is called the highest intercostal. And you actually see right here's a rib. This is the first rib right here. So it's going to be feeding the highest rib muscles and bone and whatnot. So highest intercostals. Okay, so hopefully that was helpful. Probably got a little long here. The head is one you want to take your time with. And again, I'm going to really trust that people will do the blood vessels honestly. I know it's really easy just to, especially if you're watching this video in 2020 and the time of COVID-19 here. I realize how easy it is just to open your book up and use the book. But I'm really trying to, you have to think of the long term here. If you're taking this course as a collegiate student, you're going to want to have put the work in. Now, I realize that some of you are not probably going to a medical field, so I'm really trusting you to do this honestly. I'm giving you an opportunity to do plenty of practice. I'm giving you an opportunity to do all the summative twice if you need it. So please be the trustworthy students that I know you can be. Thanks for listening, and take care.